Hello all of you. So welcome back to our channel, which is Study Smart with me. So today I'm back again with a video relatively with a PYQ or a question series of anatomy. So let's start with our question. A question is 41. So a 14-year-old athlete has been diagnosed with an isolated avulsion fracture of the lesser tubercle of the humerus. This injury is attributed to the forceful contraction of which of the following? So what would be the answer for it? Teres minor, subscapularis, supraspinatus, infraspinatus. Yeah, subscapularis. So answer is subscapularis. So you got this question, right? That a person who came there been diagnosed with the avulsion fracture. Okay. So over here, what would be the thing? Subscapularis. This. Okay. So this is the diagram I have shared. You can go through with that. Where is suprascapular foramen? Quadrangular space. This is triangular interval. Sometimes this question also come that what is this name to be. So there is coming the triangular space. Okay. So this is teres major. And where is teres? Yeah. This there. So this is latissimus dorsi. This is long head of triceps brachii. Let's see what is subscapularis. So subscapularis is a triangular shoulder muscle located in the subscapular fossa of scapula. It is one of the four muscles of the rotator cuff. So for the rotator cuff, what was the mnemonic is sits, right? It is one of the four muscles of the rotator cuff along with supraspinatus, infraspinatus, teres minor and subscapularis. So sometimes over there a choice comes teres major, so you have to rule out. The subscapularis is the largest muscle in the rotator cuff. It helps you internally rotate your arm, which means that your palm is facing back behind your body. The subscapularis muscle inserts into the lesser tuberosity of the humerus, while the other rotator cuff muscle have an insertion into the greater tuberosity. Subscapularis enter into lesser and all other in greater. Okay. The subscapularis muscle acts as a dynamic stabilizer of the humeral head and aids in lifting across the chest. Let's come to the second question, or a 42 question. Okay, so a 48-year-old woman exhibited weakness in her shoulder movements. Upon investigation, quadrangular space syndrome was diagnosed. Which nerve is most likely to be affected? Let me know this answer. Yeah, answer D. Axillary nerve. So you can see with this diagram too. This is the quadrangular space and what is the axillary nerve, right? And posterior circumflex humeral artery and vein. So axillary nerve is the answer. Here also you can see the diagram. You have to go through with that, okay? Quadrangular space syndrome is a condition that occurs when the axillary nerve or the posterior humeral circumflex artery is compressed in the back of the shoulder. Okay, the axillary nerve or the circumflex nerve is a nerve of the human body that originates from the brachial plexus upper trunk. Okay? And posterior division, posterior cord at the level of the axilla and carries nerve fibers from C5 and C6. The axillary nerve travels through the quadrangular space with the posterior circumflex humeral artery and vein. The axillary nerve travels through the quadrangular space with the posterior circumflex humeral artery and vein to innervate the deltoid and teres minor. A 38-year-old male employee, next question. A 38-year-old male employee of a house cleaning service presents to the outpatient clinic with a complaint of persistent burning pain in his knees. Clinical examination indicates what? Housemate's knee. The affected structure is the bursa. So this is the image, housemate's knee. Okay. So what would be the answer for this? Yeah, prepatellar bursa. Prepatellar bursitis is excessive compression of the prepatellar bursa, as in working on bended knees can result in pain and swelling of the prepatellar bursa. Prepatellar bursitis also called housemate's knee. Housemate's knee. Carpet layer's knee, coal miner's knee or carpenter's knee, these are also known as, is inflammation of the bursa, a fluid-filled sac that is in front of your kneecap. Prepatellar bursitis happens when your bursa is frequently irritated, damaged or infected and makes too much fluid. The extra fluid causes your bursa to swell and puts pressure on other parts of your knee. You can usually see patellar bursitis because the front of your knee will look swollen. This is the tendon of quadriceps femoris. This is suprapatellar bursa. This is patella, and here is the prepatellar bursitis. So this is known as housemate's knee when it gets swollen. This is synovial cavity. This is infrapatellar fat pad, infrapatellar bursa, patellar ligament. Now let's come to another question. During maturation of the oocytes, which of the following structures retain almost all of the cytoplasm after the first meiotic division? So what would be the answer? Yeah, ovum. So the first meiotic division results in two secondary oocytes. The ovum retains almost all the cytoplasm, whereas the first polar body does not. Most of the cytoplasm is retained by the mature egg ovum, and the second polar body receives little more than a haploid nucleus. The zoogenic meiosis conserves the volume of oocyte cytoplasm in a single cell rather than splitting it equally among four progeny. So this is the diagram. Oocyte, this is the prophase first, metaphase, anaphase, then telophase and cytokines. So prophase 2, metaphase 2, anaphase 2, telophase 2 in meiosis second. And over there is a polar body. And with the telophase, two things come, polar body and a zygote. Let's come to question 45, a last question. At which site does the fetal circulation have the highest concentration of oxygen? Which site it would be? Yeah, inferior vena cava. When the umbilical vein enters the fetal umbilicus, okay, when umbilical vein, when umbilical vein enters to the umbilicus, okay, it branches into two veins, okay, two veins, the larger ductus venosus and the smaller porta sinus. The ductus venosus is a vein which largely bypasses the liver and drains most oxygenated blood directly into the inferior vena cava. The IVC is large blood vessel that takes blood from the lower half of the body to the heart. Okay, it is the large blood vessels which takes the blood from the lower half of body to the heart. The blood from the umbilical vein that does not flow through the ductus venosus enters the fetal. The blood from the umbilical vein that does not flow through the ductus venosus, which is not flowing through ductus venosus, will enter into the fetal liver via portal vein. The blood from the IVC enters the heart by the right atrium. So this is the fetal circulation diagram. You have to go through with that too. This is ductus arteriosus. You can see lung, left kidney, aorta, foramen ovale, lung, okay, ductus venosus, liver. This is the placenta, umbilical cord, umbilical vein, okay, umbilical arteries. So you can go through with this diagram properly. So thanks for watching my video. Stay connected with my channel. Do subscribe it and keep sharing it with your friends. Thank you. Bye bye.